What's up, Misfits? Today we're going to bring you something that we had come up last week and with a couple of members lately, and is always fairly prevalent in any sort of training or physical activity, and that's back pain. But specifically, I want to use the phrase that Lance brought out to us last week, in which he described his back injury and occurrence as a high ass sprain, or HAS. We'll just call it HAS from here on out. So if you have a HAS, I want to kind of dive into what that is, what it's like, and how it's very similar to a sprained ankle. So we're doing this because inevitably back pain is going to show up, right? We know 80% of us are going to develop it no matter how great we are at our training. Now, we can do lots of things to try to decrease that risk, but if it does happen, I want to make sure, one, you know that you have us in your ring, right, to help you out through that, but also some stuff you can do on your own to make sure, is this something serious, or am I going to be okay? And how do I know what to bring up to Ryan or Megan or Gene when I'm getting seen for PT? So let's dive into it. So number one, what we typically see that tends to be most aggravating to a high ass sprain or a HAS often involves a kettlebell swing and a press. Those are, I think, the two big movements right now. We've seen it before. So if Mandy faces that way and she's doing a kettlebell swing, I'm gonna have her pause in certain positions. So she goes all the way down. She might feel pretty good in this hinge position, but as she comes up, what we're finding is that instead of really squeezing our butt and extending here at the hips, we're extending way back with our back and going like this, trying to lift up the kettlebell as far as that can go, right? So that's one option. The other is that if she's facing us and she's doing something like a thruster and going all the way through and then pressing the weight up overhead, she's arching from a back like here and going way over. She doesn't look very comfortable, right? So those are the two things we've been seeing in the last month or so that we want to make sure we highlight, is this overextension. We're always so worried about not rounding our back, staying neutral, when in reality what we're really seeing is going from a rounded position to an all the way extended position and going through. And then we seem to develop this sort of high ass sprain that I'll kind of dive into. So the next step of that is just taking a look at Mandy's back for a split second. Now this is helpful because I think a lot of you guys describe this pain that goes across. So often, if I go from right here, you'll feel a pain kind of go almost right across the low back here. If you go right kind of above your butt cheeks, there's little kind of bony dimples that pop out. That's right where your hips meet your back, right? So right above that is where the low back begins. And a lot of you complain or have issues with back pain going across. Now, we need to differentiate and be more specific with that. The best way to do that and to give us the best information to help you is to run through the movements of the back. So here they are. Mandy's going to go down and touch her toes. Cool. See if she has pain or not. Come back up. She's then going to put her hands on her butt and bend backwards a little bit for me. See if she has pain with that, right? She's then going to take her right hand and go down her right side. See if she has pain with that. And then left hand down left side. Cool. Two more things. She's going to rotate all the way to the right or left, as far as she can go, as far as she can go, as far as she can go. And then the other side, as far as she can go, as far as she can go, as far as she can go. And then she's going to do the genie move. So she's going to move like this and move her hips to the left and to the right, keeping her upper body still. So all the way to the left and then all the way to the right. And go from there. So what does that all mean? Well, one, it gives us a great baseline of what movements do or do not hurt you. Is it extending? Is it bending over, rounding, or flexing? Or is it going side to side? Now, the easiest way to look at it is if you feel pain on one side, it's like a sprained ankle, right? In Mandy's back and along her kind of spine there's tons of joints and muscles and a million other little things. For us to pinpoint exactly what it is darn near impossible. But what we do know is one side oftentimes is more painful than the other. So when Mandy moves her hips or bends over or closes down one side of her back, that's usually an indication that she has some sort of high ass sprain right there, right? Because it's kind of right up in here. So, and if that's the case, if it's one-sided, the best way to do is look at it as a sprained ankle. If you sprain your ankle, you're going to walk with a sort of a limp, right? You're going to try to avoid that side. Your back does the same exact thing, just in a more subtle way. If Mandy's having pain on her right side, she's going to probably try to avoid it by going this way. She might even start walking goofy, or if she goes to press overhead, she might try to avoid it very subtly. So you might just be bothered by it, but your body's trying to avoid coming onto this right side as much as possible. So what we need to do is reintroduce motion the same way you would for an ankle sprain. So in the end, what we need to do is the exact same evaluations that we did. You can go through those movements and slowly press into those motions, right? Doing that repeatedly and slowly bringing that motion is the same thing as slowly starting to relearn how to walk gently on that sprained ankle. Do it slowly into threshold and then come on back and repeat multiple times throughout the day. That's going to be your best friend. If you start avoiding the position the same way someone might avoid trying to walk on their ankle, you're only going to prolong the recovery. Follow that up with coming to see us for an HAP where we can prescribe and dose out appropriate amounts of deadlift and back and core work to allow you to slowly build back and then modify the classes for you. You're going to be way better off in the long run if we can address it proactively than reactively. So I hope you like that little content for the high ass sprain. Thank Lance for that unique name that will probably still with me forever. So look forward to that. Be cautious and understanding of those things and kind of go from there.